Yes.
This conference will now be recorded.
Hello, everyone. Welcome, and thank you for joining us for today's ACRM pandemic webinar, which is part of a series of webinars produced by ACRM and the ACRM Technology Networking Group to help bring needed information to rehabilitation researchers and providers regarding the use of telehealth during the pandemic. My name is Fofi Constantinidou, and I'm the chair of the ACRM International Networking Group. Today's webinar was produced with special collaboration from CPLO, which is the Standing Liaison Committee of Speech and Language Therapists in Europe, along with ACRM and the ACRM International Networking Group. I would like to thank the leadership of CPLO and ACRM for their efforts in support of this webinar. Today's webinar will be presented by Dr. Suzana Jelčić Jaksic and is entitled Use of Telepractice for Speech-Language Pathology, Lessons from Europe. Before we get started with the presentation, I do want to advise that this meeting is being recorded. I'd like to ask all attendees to keep your phones or mics muted and keep your cameras turned off throughout the presentation. We do expect to have about 20 minutes available for discussion at the end of the webinar. So if you have questions, please type them in the chat feature, and we will address as many of those as we can during the last part of the hour. And with that, it is my great pleasure to introduce our guest speaker, Dr. Suzana Jelčić Jaksic, who was nominated by CPLO to give this presentation. I would like to provide a few words for our speaker. Suzana graduated from the University of Zagreb in 1986 and completed her MSc and her PhD at the same university. A recognized European Fluency Specialist, she currently works at the Children's Hospital in Zagreb, diagnosing and treating children and adolescents with speech and language disorders, focusing on fluency disorders. She also teaches on postgraduate courses at medical school and supervises students on clinical practice in fluency disorders at the University of Zagreb. She also teaches at the University of Mostar. She has published numerous professional and scientific papers and is co-author of several books and manuals. Since 2010, she has organized the triennial Croatia Stuttering Symposium in collaboration with the Australian Stuttering Research Centre at the University of Technology in Sydney. As a person who herself stutters, Suzana founded the Croatian Association for People Who Stutter and has been its chair on several occasions. Dr. Jelčić Jaksic, we look forward to your talk and will now turn the presentation over to you.
Thank you, Fofi, for this nice introduction. So you already heard that I'm a speech pathologist, that I live in Croatia, and you can conclude that I have, from the start here, I think, two disadvantages, if I may say so, because I stutter and my first language is not English. So I hope it will all be okay. So today I have to say that I have no disclosures regarding financial and any other issues. And I will try in my presentation to give you an overview or to get you better insight in telepractice in speech pathology. So I'll say something about research into evidence-based telepractice in speech-language pathology, and as coming from Europe, I will say something about that. I will say something about advantages and limitations of telepractice in our field, and I do hope that we will have a good discussion at the end on this topic, and about a comparison of telepractice to face-to-face assessment and intervention in speech-language pathology. So let me first say something about where I come from, where I live, because I think it is important for this topic. So you can see here where Croatia is, Americas, Asia, Australia, Africa, and Croatia is in Europe. Here you can see it better. It's between Italy, across the Adriatic Sea. Our neighboring country is also Slovenia, Hungary, Serbia. We have a long border with Bosnia and Herzegovina, and a short one with Montenegro. In Croatia, the capital of Croatia is Zagreb, and here I live and work. And just a few facts about Croatia. We have a population of just over 4 million inhabitants. We are a small country, but we have more than 1,000 islands, which is also important to know when we talk about telepractice in our field. Only 48 of those islands are inhabited. When we talk about health care in Croatia, we should know that, of course, larger cities can offer better health care quality, and on all those islands and in distant places, health care is restricted. What is the main difference between, I guess, most European countries when compared to United States, for example, is that we have national health care paid by all employees, employers, and self-employed people. So those who don't work or children, they are also covered by basic national health care. Actually, children in Croatia don't pay anything for any health services. Also, socially sensitive categories like retired people or those from families with low income, they also don't pay anything, but they have access to basic health care. In the capital, in Zagreb, since 1962, we have a course for speech-language pathology. So that course is my age, actually. So only one course in whole country. We also have Croatian Logopedic Association, which was founded almost 30 years ago. And at the present, we have just over 600 members. Speech-language pathologists in Croatia work in healthcare settings, in educational, social care settings, and in private practice. Some of them work there. Okay, let's go to telehealth, which is our topic tonight. So, according to, there is an excellent paper, the latest one, I think, the latest systematic review published this year by Widener and Lohmann, which gives please turn off your Okay. So this paper was give an overview and talk about important documents from the USA, where during last few decades, telehealth was seen as a life-changing potential, as uniquely positioned to meet future healthcare goals. It says in a document called Healthy People 2020 that telehealth applications are here to bridge service gaps. And in the latest documents in the United States, in Healthy People 2030, it says that the goal should be to eliminate health disparities and to promote health equity. So I think it says actually how important telehealth is, and it is stated so in important documents in the United States of America. We should also know that when we talk about telehealth, and if we want to define it, actually we can say that telehealth is everything that is not face-to-face. So any intervention that is not done in that way. In that sense, we talk about synchronous, which is live and interactive video communication. And in that interactive and live way, we can do our interventions and assessments. But telehealth also is asynchronous form, which is done by storing, making databases of certain materials or certain data about our clients. And those data can be transmitted, but those actions are not happening in a real time. So, for example, you can have a set or sets of therapy materials for your clients for certain pathology that you work with, and you can, when you need to, you can actually tailor them and set a program for a specific client and then send it to that client. The client, on the other side, can do those exercises, can do homework in their own time. That time they can record themselves, and it's also stored somewhere. And when you want to, when you can get to it. You can analyze those recordings. And that's also good because you can actually store all those data. You can store all those recording, which may be useful for later research or whatever. The other form of telehealth is remote patient monitoring. And that means that you can transmit patient data for a remote healthcare professional to analyze and monitor. For example, assessment of swallowing and swallowing disorder can be done in that way. There is a case described, and actually there is research done on that an island had equipment that was needed to assess swallowing of a certain client, but there was no specialist present there. So some other people not specialized in the field of swallowing were doing assessment, and those recordings were sent, or the specialist at the other end of country can actually see it, can comment it, can communicate with those people doing actual assessment and tell his opinion. And the last form of telehealth is mHealth, which are various applications that helps in promoting health. Telepractice is actually within telerehabilitation, which is within telehealth. So telerehabilitation and telepractice, as it is said in that same article that I mentioned. On the other hand, we can see in a document from 2014 by the Speech Pathology Association of Australia that telepractice is also called and is known by terms of telehealth, telerehabilitation, telespeech, and tele-SLP. In Croatian language, personally, I like term telelogopedia. So all those terms actually somewhere or sometime refer to telepractice. If we want to define telepractice, there are two actually very similar definitions of telepractice, one from Speech Pathology Australia and the other one by ASHA. So it says that telepractice is the application of telecommunications technology to delivery of speech-language pathology and audiology professional services at a distance by linking clinician to client or clinician to clinician for assessment, intervention, and or consultation. And I think this is all also very clear. So these two speech pathology associations from two large countries are available, but when you search for telepractice on European site, one of the European site, you actually can't find that term. It was the same when I searched for telerehabilitation, telemedicine on that page that is dedicated to speech pathologists in Europe. So there is no official definition for telepractice. And here we come to research, where we also can see that most articles published in peer-reviewed journals come from United States of America and from Australia, two large countries. Some come from Brazil, which is another large country, and very few from Europe. Well, why is that? I can think of several reasons for this. First, for example, people in the United States of America and Australia live in quite deserted and not very populated areas. So in Australia, many of us can remember seeing it in the movies, how children were some 50, 60, long time ago, schools were actually not done always face-to-face. So children just couldn't go to schools, but they would listen to school programs on radios and later, I guess, TVs. So in those cultures, doing it not face-to-face, educating not face-to-face is in tradition, and it's very normal. Europe is much smaller. European countries are much smaller, so there was no need for such communication and education. Another thing could be that in United States of America and in Australia, there are many universities with clinical centers. So clinical research can be easily done in such centers at such university. it's normal, and actually people work there to do research and a lot of clinical research. While in Europe, there are not so many universities that have such conditions. They don't have clinical centers within universities, so there is much less research done because of that as well. I'm sure we can think of other reasons for that. There are many articles written on telepractice in speech pathology, and actually they cover a wide variety of pathology of our disorders. But I would recommend to everyone to read the latest one, which I've mentioned already. It is a systematic review and gives really good insight into all studies that have been done so far. As example of some more specific article and research is one that is done on telehealth delivery of rapid syllable transitions, for example, for childhood apraxia of speech. So there is quite a lot. When we talk about Europe, then there are a few German articles and Netherlands, and they talk about ways of using telepractice in treatment of aphasic clients, and also with people with dysarthria. What I can tell you now, because all of you can read all those articles, but in summary, all those studies came to conclusion that there is no difference between treatment, face-to-face treatments and telepractice. Even a number of them came to conclusion that telepractice gave better results. It was more effective, it was more concentrated, it was just easier to deliver and easier to get. Okay. So here we come to CPLO, which is liaison committee of EU speech and language therapists and logopedics. Actually, CPLO is an umbrella association that covers over 40,000 of speech therapists working in various European countries. And so there are national professional associations who are all under CPLO. And why I'm talking about CPLO? Because we live in a very interesting and I would say unique times, unique era these days, these few months. And because of that, CPLO did a survey and gave some recommendations to national associations to get to government of each of those countries. CPLO thinks that speech pathologists need to actually be better treated, I would say, during these times. So in their recommendations that were a result of a recent meeting of CPLO board in April, they stress the use of telehealth and telepractice to ensure the continuation of therapy rehabilitation. There, they especially talk and stress and give examples of a few few areas in our field which really should be covered, and say why speech pathologists should be able to go on working even during pandemic times. So they say, for example, that people with swallowing disorders really need speech therapy or our services even during these times, because if we stop giving them therapy, then it can be really a life-threatening condition. Also, this new virus can also make new cases of swallowing disorders. The other example is those with autism spectrum disorder, whose lives have changed a lot. Those people, those children lost their everyday routine, which we know how affects them. So they certainly need our interventions during these times as well. There is a survey that CPLO carried out at the beginning, during the first week of April this year, and they got 30 responses from 27 European countries. There are some interesting data from that survey, which found 10 countries in which authorities did not recommend telepractice. In 13 countries, there is no mention of telepractice in their legislations. And in 2 countries, it is even illegal to carry out telepractice. So only emergency cases and hospital patients were being seen at the time. In some country reported that the professional organizations pleaded the government to stop their work due to high risk factors. Insurance companies also do not pay speech language therapy sessions in 12 countries, but in 3 countries phone consultations were allowed but not paid for. In all countries, speech pathologists were granted special leave to stay at home, except in Slovakia, where it was not paid. I can say for Croatia that we were also on leave, or we worked from home, and it was paid. In 6 countries, the government had not announced any economic measures to aid those professionals in self-employment who suffer significant losses to their income. And we are talking about April. There are other things like SLPs were asking for guidelines, what to do. Those working in hospitals were not given protective gear, no training or advice on protective measures, or they were not tested, although they were in touch with the infected people with coronavirus. So in conclusion, CPLO concludes that there are discrepancies amongst European countries, and that they should be seeking to alert authorities and European institutions to ensure that all European countries have established regulations that allow the legitimate service delivery of therapy, and that is covered by the insurance, which is really important. I see now that I have, 10 minutes left? Okay. I'll go back to Croatia, and we are small. We didn't test a lot of people, but we had some cases of coronavirus, not more than 2,300, and we have under 100 deaths so far. And I would like to say something about speech therapists in Croatia, how they worked, how they act in these pandemic times. So those speech pathologists working in health settings, as mentioned before, they had to work, which is contrary to what I heard from a colleague from Slovenia, who said that they were paid to stay home. They got they got 80% of their full salary. In Croatia, we had to go to the hospitals to work there and to organize our work differently. The problem was that at the beginning, we didn't know if ever our services would be paid. So thanks to our national association, actually we got now assurance from the authorities in health services that it will be paid, that for this time only, so temporarily, that our services done by telehealth would be valued equally by the insurance, the national health insurance. In my hospital, we were divided into two teams at our polyclinic. So each team had one speech pathologist. And when working from home, so we were exchanging every week. And when working from home, I did telepractice, which was not obligatory. I mean, some people were only making phone calls, advising their clients, or mostly parents, in my case, because I work at the Children's Hospital. So in educational services, speech pathologists were also in telephone contact. They were sending emails with materials to their client and so on. So speech pathologists working in these settings were obliged to follow the rules that were given by the government, how to act and what to do. Speech pathologists in private practice, they had that freedom to choose. No one, it was not forbidden to them, for them, to use telepractice and go on giving their services to their clients. So I was wondering what was happening in Croatia in that way, and I gave a brief. I sent a brief survey to private practice speech pathologists in Croatia. I sent it by email to 46 addresses, and I got 11 or almost 24% responses. 11, actually 12. I got one reply today, but I couldn't include it here. So just a quick tour through it. Those respondents were from larger cities, from the capital and a few other cities in Croatia. Their age, I thought it would be interesting to know their age. It was between 31 and up to 60. They had between 6 and 13 something years of experience. They did they were doing performing assessments and therapy in their private practice before pandemia, and they treated all disorders. Actually, some of them sent long lists that covered all disorders that speech pathology treat. They treat from preschool children to adults. Only a few of them treat only children, preschool, primary, or up to adolescency. What is interesting that before this time, 7 of those 11 never used telepractice, and 4 of them did, even for 8 years. Some of them more or less frequently. And during pandemia, during COVID-19 crisis, 8 of them used telepractice and only 3 didn't. When asked why they didn't use it, these are their replies. I was late, said one colleague, because she planned to start using, but by the time she felt ready for it, those measures, lockdown, were moved, and now she's seeing clients face to face again. Most clients didn't show interest, traditional attitude, and not positive attitude towards telehealth, teletherapy in general. My colleagues worked mostly with children, and they did early intervention. They treated articulation disorders, language disorders, dyslexia, stuttering, so also a variety of disorders. Most of them performed only interventions, which means therapy and parents consultation, counseling, and so on. And only 3 of them also did assessment. And they used mostly Skype, that's the most popular, but also applications, because in my experience as well, many parents, many families don't have laptops, so they would all have Viber or WhatsApp on their phones, and those are the most popular here, and they can also be used in telepractice. I would end here because I think the time is up, but I would want to say something as well.
Okay.
I would like to say something as well. I mean, to conclude this, to say a few things about positive advantages and disadvantages of using telepractice. I would say, and I'm asking you to also send questions and say your opinions about it. So I personally see many advantages of telepractice, and I would personally, and that view I base on my experience, I would recommend and I would like telepractice to be covered by insurance, to be available, to be there all the times. Why? Because it makes very often therapy easier and more effective, because people can more easily attend such therapies. It saves money, it saves time, it's simple. One of these disadvantages can be that that it may be difficult for older people, or for people with, for example, cognitive disabilities and so on. So they would need someone to assist them in using it, but they may be the case in face-to-face form of therapy as well. Also, the country has to be well covered by strong internet connections, and all consumers, I mean, both sides should have strong internet. So these are only a few things, but I think that advantages of telepractice are much much stronger than disadvantages. Well, thank you.
Well, thank you, Suzana, for sharing your experiences and expertise in some of the challenges and some of the practical aspects of telepractice. We do have a few questions by our audience. Before we go on, I would like to wear my CPLOL hat as Deputy Chair of CPLOL and say that the document that CPLOL sent out to member states has had a number of different spreading effects within the European scene, in that we also sent it to the Commissioner of Health, and we also received a response from the Directorate General of Food and Health, promoting the use of telepractice in Europe as a viable modality for service delivery, which I think this is a great celebration for telepractice in Europe. And this is very, very important in that it can be used now, this information, as ammunition to member states to advocate for telepractice and for reimbursement and for insurance. Now, one of the questions we had, Suzana, had to do with creating a relationship with a client and even with younger children if one has not met them in person. So we would like your expertise in dealing with issues such as building rapport and some advice you may have for clinicians who are entertaining to use telepractice and are being concerned about that aspect of treatment.
Thank you. This is a very, very good question. When I heard about this webinar, I mentioned it to my colleague, a psychiatrist. And she had rather negative attitude towards telepractice in their field. But I think it really can be very, very similar, speech pathology and psychiatry in a way. So she said something like she said something like when you don't see
Ce faceți, măi? Oprește-te din acțiunile fără niciun rost.
Okay. So she was saying something like you can't feel the client in the way you can face to face. You can't notice those fine things or facial or something like you can face to face. My answer to her, or my comment, was that I think it is like when you are blind, you know, then you actually make your other senses stronger and higher, and you feel through other senses more, so you compensate. So compensation is one way of seeing it, but that compensation actually develops through experience. So my advice would be to my colleagues around the world just to be brave and to start. Because you are sitting in your chair, you see a client which maybe would be in the same position at your room in the hospital. So the child enters, even if it's a small child. The child enters the room, and here actually the screen is opening and the child sees you. So what is important there is your face, your expression, and your way, of course, your skills, how to get to the child, how to communicate with the child, depending on its age and other skills. The other important thing there would be to talk first to parents or anyone else, a carer, who will be in charge on the other side to prepare the child well. So that's about it so far. I hope I helped.
Thank you. The other question is about evidence-based reviews for treatments that relate to children, because there as one of the members of the audience pointed out, the Widener and Lohmann review was primarily for adults. So where would you recommend people look for reviews relevant to children?
Can I later maybe send it, or someone gets to participants with exact references to that? But I can say that in general, I can talk. For example, my field is stuttering. So in stuttering, there were studies done, and groups of small children were compared. There are a few therapy programs, intervention programs for treating young children for stutter. There is one for children from 2 to 4, and another one for children from 4 to 6. In all those programs, parents play a very important role. So, as I mentioned, in a general advice how to deal with small children in telepractice, the same goes here. So the most important thing is to prepare parents to make a rule, but that's also the rule for every therapy, for each session. You should be clear in your rules. So it can be easily done. Actually, you are in those stuttering treatments, you are teaching and demonstrating to parents what to do and how to do it. So again, those studies, those are done by Australian teams, showed that there was no difference in quality and results of therapies.
Thank you. I also pointed to our audience that ASHA has a for those of you who have access to the ASHA website, and this is actually available to non-members as well. So if you go to asha.org, it has a list of telepractice resources that are free, and a lot of evidence-based reviews. Also, if you I provided an email address, that's the Cypriot SLP Association. We have compiled a list of reviews. And I also see that the Michael Palin Center also has some information as an additional resource. Suzana, some other questions that would like your experience, because you've been using telepractice for a number of years. How do you deal with resistant families?
Good question. Yeah, actually, in my experience, and I've been performing using telepractice for 9 or 10 years now. So I can say that I started doing it because I had a client, but he was then 19, who I've seen when he was younger, and then at the assessment, and then he was studying in another city. He was studying actually to become a priest, and we were doing telepractice. It was on Skype, and it went really well. Now in these pandemia COVID-19 crisis times, actually everyone to whom I offered such way of therapy, everyone agreed. Some of them were skeptical, but when we started it, they really loved it, and children loved it, and adolescents loved it. Some of our adolescents said at first that it was like, you know, like odd, like weird, but they liked it. And I think as a game in general, that clinicians' view, clinicians' attitude is very important. If you are not sure that it would work, if you don't believe in it, if you're anxious about it, of course the other side, would sense it. So be sure that it works. Be sure to stay natural, because it is actually natural conversation. You can't touch each other, but nowadays we really shouldn't be touching each other. So it is normal, and yeah, your positive attitude toward it helps. And if people trust you as their clinician, as their child therapist, then they will trust you and follow you, and you will have a good therapy.
Okay, thank you. Another question from our audience. It's regarding some legal aspects of telepractice in Europe. So an SLT who applies telepractice with a client who lives in a different European country, is that person required to have license to practice in the country that the client lives?
I can say for Croatia and neighboring countries, Fofi, but I'm sure you can say more about it when it comes to Europe. So I can say that unfortunately in Croatia, for example, we don't have our chamber. So telepractice or let's say having a client for another from another country is not illegal. I don't think so. So you can work with anyone. Actually, there is no control, I think, over it.
Yes, this is our understanding too from the survey we conducted with CPLOL, and also from the communication we received from the Director General of the European Commission, that it is left up to each country to develop its own regulations and requirements. Our understanding is that right now there isn't guidance in terms of that particular aspect. Also,
Yes.
I'm sorry, Suzana.
No, sorry, go on.
Another question for you. We talked about potentially resistant families, but how about strategies to convince even colleagues within the same field? Because sometimes initially the attitude with telepractice was that it's just here for COVID, just for now, and then we should not be using it. But you have a longer history of using telepractice. So how about resistant colleagues, even within speech-language pathology, or even across disciplines like physicians and other therapists? What are some strategies you have used to help them understand that this is not a type of treatment, it's a treatment modality, and that this should be supported?
Yes, first I have no problem with that, because I'm just doing what I think is right, and that's it. But when it comes to our colleagues, to professionals within our field or other professions, I would expect them to accept scientific facts, evidence-based information, and results of all those surveys. And so from them, I would really expect them to listen to the science. So the science and experience, and there were clinical trials that prove that that is just a form of delivering our services.
Okay, thank you.
Okay.
No, I didn't mean to interrupt you, Suzana.
No. I was going to refer to medicine because, for example, in Croatia, there are some fields within medicine, like in surgery, with high how to say it, with cardiosurgery, you know, and other sophisticated fields and procedures. You know, so telemedicine is okay there because it's very exact. And I really think that in our field it can be, and it has been proved that it works.
Okay. And the last question before we adjourn for tonight has to do with the use of interpreters in people with linguistically and culturally diverse backgrounds. If you had any experience or any recommendations in terms of using interpreters.
I don't have much experience there, not even face-to-face work, so unfortunately, I can't say much about it.
Okay. One would assume that we would use the same approach as with the face-to-face meetings in terms of and ensuring the technological aspects of the partnership as well. I would assume, wouldn't you say?
Yes, I would believe so. I would agree with you. Yeah.
Okay. So I think we're close to the end of our webinar. I would like to thank our speaker, Dr. Suzana Jelčić Jaksic, for her presentation. I would like to thank everyone for listening, for your engagement in the chat. It's great to see so much interaction. Please note that the recording will be available in the next 24 to 48 hours. And please do recommend this webinar series to your colleagues. All of the webinars are available for free to everyone on the ACRM website. And so this concludes our episode for today. Be safe and stay healthy, everyone. We hope to have you join us again in the next webinar. Goodbye.
Thank you. Goodbye.